allergies.
I see.
Okay, you're on.
Okay. I'm going to close this. I learned how to start it when I want to start it, so all of this I can cut out.
Okay. Alrighty.
Okay.
Shoulder.
So,
Okay.
welcome to our workshop today, Relieving Common Pregnancy Complaints. The reason why I wrote this workshop is because in 25 years that I've been in practice, I have found that pregnant women are routinely told by their doctors that it's okay to take over-the-counter medications for common things that happen during pregnancy. And the truth is that every single thing that you take will affect your baby in one way or another. So there are many ways to take care of pregnancy complaints that don't involve taking drugs. And so I created this workshop to teach pregnant moms how to deal with those complaints without having to resort to drugs. So we'll talk about a lot of things regarding proper posture, proper way to move in different things, and then we'll talk about some specific things to do for problems like sinus problems, headaches, and other things that are common in pregnancy and that can be dealt with in natural ways. First, let's talk a little bit about standing. The worst thing that you can do when you're pregnant is to have your pelvis get out of alignment. Sometimes it can go like that, or up on one side and down on one side. And we actually do that to ourselves because of the way we sit, the way we stand, the way we carry other children on our hip. So when standing, it's really important to have equal amount of weight on both feet so that your weight is balanced on both feet. But at the same time, if you're going to stand for a long period of time, you want to make sure that your pelvis doesn't do that, which is a really common thing because you have so much weight in the front that the tendency of your body is to allow that to happen. That causes a lot of pinching right here. So we need to keep our pelvis under our shoulders, and we also want equal weight. If you're going to be standing for a long time, ironing or doing dishes or anything that requires you to be in one position, one thing that you can do to avoid that forward pelvic misalignment is to put your leg up on a stool. So you can alternate feet, and that will make sure, because as soon as you lift your leg up, your hips come back. You can't be doing that if your leg is up. So equal amount of weight on both feet, not allowing your hips to go forward, and not carrying your children on your hip right here. When you're sitting, also very important that you have equal amount of weight on both hips. So sometimes we sit leaning more to one side than the other, and immediately that causes our pelvis to shift to that side. The other thing is keeping both feet on the ground instead of letting your legs dangle. Sometimes if we're sitting in a chair that's too high or the back is too deep and our legs don't touch the ground, what ends up happening is that the edge of the chair is right here, and the pressure that it puts against the back of our leg actually cuts the circulation off. And already pregnancy has a tendency to bring some swelling of the legs, of the feet and the ankles, and if you on top of that are cutting the circulation here, that's just added insult. So keeping both feet on the ground, making sure they're not dangling, and having equal amount of weight, which means crossing your legs is not a good thing, pregnant or not, because that shifts your entire weight over to one side. Keeping your legs up on a stool is a really good thing if you're experiencing any type of swelling in the legs or down in the ankles. And if you have the kind of swelling that when you put your finger in, you actually leave a pit, then something that's really good to do is to take your legs and put them up on a wall. So you can lie down on your bed and put your legs up on a wall like that. That makes all the fluid come back to the heart, and it takes care of a lot of swelling in the ankles and the feet. This position at the bottom is called the lotus position. It's a yoga pose, and it's really a good thing to do because it begins to open the pelvis up and prepare you for the birth process. This slide is just to remind us that anything that puts constriction around your arms, your legs, your stomach is also going to cut circulation off. So socks, like if you wear knee highs, sometimes that puts so much pressure right here that it actually causes you to get varicose veins. So avoiding elastics around your arms, around your stomach, around your ankles and your legs is really key right here. The way to get in and out of bed is the same way that we teach you to get on and off the table. Instead of trying to do a sit-up from a lying down position, you should always try to turn on your side and then push yourself up to a sitting position and then get up. That way you're not straining your abdominal muscles and you're not straining your back muscles. If you imagine that your uterus has a waist to it that goes around like that, from the waist of the uterus coming down are two ligaments that attach to the back of the pubic bone right here. Those ligaments are called the round ligaments. And as the baby starts to get bigger and bigger, those round ligaments become a little bit more taut because of the size of the uterus. It just starts to pull. So if you move really quickly, like that or like that, what's going to happen is the baby is going to move really fast and it'll pull on one of those round ligaments. If you go to the right, it'll probably pull the left one and vice versa. So avoiding quick movements is really important as the baby gets bigger. Even getting off the adjusting table when you're on your stomach. That's why I put my hands under the baby to help you come up, because just having the baby hang like that quickly will pull on one or both of those round ligaments. So one, avoid those quick rotational motions. But second, if you do have it, leaning onto the side where the round ligament is hurting is a really good thing, because it reduces this distance from that uterine waist, let's say, to the pubic bone, and so the ligament is not stretched and taut anymore. Using ice, once you've stretched the round ligament, is also really good. The round ligament, even though it's called a ligament, it's kind of a combination of a muscle and a ligament, because it has muscle fibers in it. That's why it responds to massaging it, icing it. Another ligament doesn't care. You can't do any icing or massage to that, but the round ligament you can. Cramping, you were asking me about that. Very common in pregnancy. Either the calf muscle cramps, which causes your toes to do that, or your actual muscles cramp right here on the top of the foot, which cause your foot to start going like that. So if you have any kind of cramping, the worst thing to do is to massage the muscle that's cramping, because that will give you a painful bruise and it actually doesn't do anything for the cramp. But the best thing to do is, if this was your foot, to bring your feet, your toes back like that. So it's called dorsiflexion. You dorsiflex your foot, and that will stretch the muscles of the cramp, which are usually right here or right under the foot. So that position will cause a very slow and gradual stretch, which will stop the cramping from taking place. If you're getting a lot of cramps in your toes, in your calves, anywhere in your lower extremities, an exercise that works great to prevent these cramps is to take a little towel, drop it on the floor, and barefooted, just crunch the towel like that with your toes. And if you do that every night, you will prevent having any kind of cramping in your legs. So it's just something to do at night when you're watching TV, or at the dinner table if you're reading a book. Just have your little towel and scrunch, scrunch, scrunch. If you have cramps in the upper back, having a massage is something that really helps. And as it's true with yoga, chiropractic, or massage, if you're going to have somebody working on you, you make sure that the person has been trained on pregnancy massage. There is a lot of different ways that we deal with pregnant women that we would never, different things that we do to pregnant women that we would never do to a regular person. That's why we have to be trained in prenatal chiropractic. Same thing with massage, same thing with yoga. So it's really important to make sure these people know what they're doing. This is true whether you're pregnant or not. Lifting is one of the hardest things that you can do for your back. And if you lift with your back, which means that you're doing this and you're bending at the waist, you're putting all the effort of the weight right in the lowest segments of your lumbar spine. Instead of doing that, you should always keep your back straight and bend your knees, which makes all of the effort come from the muscle of the legs, which are the longest and the biggest and strongest muscles in your body. So anytime that you lift by doing this and bending your back, the farther away that the object is from your center of gravity, it doubles every inch that it's far away from you. So let's say that this thing weighs a pound. If you're trying to lift it like this, and you're about, 10 inches away from you, at 1 inch it weighs double. At 2 inches it weighs 2 times that. At 3 inches it weighs 2 times that. So it exponentially gets heavier by the inch. So that if you're out here and you're trying to lift something, this weighs like 100 pounds instead of 2. This is really important if you have children and you're trying to lift them up. Same thing, if you bend over at the waist and you try to pick them up like this, you're putting so much strain in your lower back that over time what you end up doing is actually tearing the discs in the lower spine. So, what to do? Always bring the object that you're trying to lift as close to the center of gravity, to your center of gravity as possible. And second, never lift like that, always lift like that. So if it's a child, bring the child as close to you as possible and then lift up with your legs. And this is true whether you're pregnant or not, just to protect your spine. As your baby begins to get bigger in your stomach, it's going to take up a lot more room in your abdomen. And this is going to cause at some point that you're going to become short of breath. Because as this gets pushed up, the amount of space in your chest cavity gets reduced. So one thing that helps a lot in the final months of pregnancy when you are getting short of breath is to raise your arms over your head, just like that. You can do it sitting, or you can do it just lying down in bed. As soon as you raise your arms, what happens is that you increase the size of your thoracic cavity and your lungs are able to expand and take a big breath. Sunlight is really important. In this country, people are very afraid of the sun because of skin cancer. But the truth is that we all need to receive sun, and our entire skin, if it could be exposed to the sun without any clothes for 10 to 15 minutes a day, that would be the ideal thing. Because when the sun hits our skin, some reactions happen in the body which end up producing vitamin D. Vitamin D is an extremely important vitamin, which is an anti-cancer vitamin, by the way, but for a lot of different processes that happen in the body. So being out there in the sunlight for 10 to 15 minutes a day would be a great thing to do. Of course, you're not going to be there at noon when the sun is at its highest. If you go at 8:30 in the morning or at 6:30 at night, you can still get great sun exposure and not have any of the side effects of it. So very important thing to remember to do during pregnancy. I think that back tension and back pain are probably the #1 complaint that pregnant women have. And I'll show you a little bit later the anatomy of the spine and why lower back pain is so common. But one thing that is very helpful to relieve this kind of pain is to do this pelvic rocking. That's what in the yoga classes. Go ahead. In the yoga classes, I refer to that as the cat-cow position. So you're on your hands and knees, and you arch your back up like a cat that's stretching. And then you relax it back to flat right here. And then you just keep arching up and flat, up and flat. One thing that you shouldn't do is to cause this kind of arch downward, which in the yoga classes they call that the cow position. So you can do cat, but you cannot do cow. This pelvic rocking is something that you can do if you're experiencing back labor. It is really helpful if you're having back labor pain. Now, the pelvic rocking can be also done in a lot of different positions. You can do it standing by just tipping your pelvis like that and then relaxing it, tipping it, relaxing it. You can do it on an exercise ball, sitting on it and then just rolling your pelvis back and forth like that. Or you can do it lying on your back with your knees bent You flatten your back down onto the bed and then you relax it. But in all of these instances, always remembering that you don't want to arch this way. You only want to go from flat to this, back to flat. I'm going to give you some ideas about what you can use instead of using these drugs. But these are drugs that are always being told to pregnant women that are safe to take. And the truth is that they all are known to stunt the growth of your baby. So things that you would take for congestion, for stomach discomfort, for constipation, for colds and coughs. Let's talk about some of the alternatives. Do you know what an neti pot is? Mm-hmm. Okay. So a neti pot, for those of you who may not know, is a little Aladdin lamp-like with a spout and a handle, and it's actually used to wash your sinuses. So you can put it in the nostril and it washes all the sinuses and it drains the other side, and then you do the same thing. So using a neti pot for sinus problems, for inflammation of the nasal membranes, which is called rhinitis, and then if you're actually having an infection going on, sinus infection, using a combination of clove, cinnamon, and thyme essential oils. 3 drops of each on a facial steamer, and then you breathe that. And all of these 3 oils are known for antimicrobial, antibacterial, antiseptic qualities. So it's like taking antibiotics, but you're not getting any of the side effects. For babies, you can do the same thing. You can actually go into a shower, just turn the steam on and have some of these essential oils right there, and then you and your baby can just breathe the steam, and it's something that's very, very good. For swelling, there are a lot of things. The essential fatty acids, which are the omega-3s, those can be taken in pill form. They sell them at the health food stores. You can eat sardines, salmon, flax seeds, flaxseed oil. All of those are very rich in essential oils. Dandelion tea is known to be a very gentle diuretic that helps with swelling. And then arnica, which is a homeopathic remedy, is really good to relieve swelling in pregnancy. So there's a lot of tricks to do, a lot of things, natural remedies that can be used instead of taking these drugs. Even aspirin and non-steroidal anti-inflammatories are known to increase the risk of miscarriage in the first trimester by 80%. This is according to the British Medical Journal. Aspartame, which I put in here because I consider that to be a drug, that's NutraSweet, what they use to sweeten all of the diet products, also known to alter the brain growth of your baby. So pregnant women who are drinking diet sodas, who are eating any kind of diet products that are sweetened with aspartame, bad news. Accutane and Tegison are 2 skin medications, and they are known to cause birth defects. So all of these drugs that are routinely prescribed to pregnant women are known to have terrible side effects on their babies. So why is low back pain so common? If we look at the body of the pregnant women, you can see that the normal shape of the spine is exaggerated by the increased weight in the front. So the more weight that you have here, the more this curvature keeps being pulled forward. And as a result of that, the nerves that are right here actually become compressed. And that results in sciatic pain, lower back pain, numbness that goes on the side, which is also a really common pregnancy complaint. In the mid-back, the weight of the breasts and even part of the weight of the baby are also pulling forward on this curve, causing it to flatten out. So this curve becomes exaggerated, this curve becomes flat, and that ends up causing them a lot of the problems with nausea in pregnancy come from the mid-back area. And in fact, there's a great adjustment that's done right here to relieve nausea that it works really well. at the same time as these things are happening, the neck starts to be pulled forward, so then they end up standing like that, and the misalignment causing all of the pressure right here in the nerves that come from the neck results in headaches, high blood pressure, a lot of the problems like preeclampsia and eclampsia having to do with problems with the spine compressing nerves, thereby causing health issues. So it's all a biomechanical issue that actually starts to affect the nervous system, and when the nervous system is affected, then functions in the body become affected. Another really common problem in pregnancy is the subluxation of the pubic bone, and this bone right here actually can subluxate forward or upward. And when that happens, the most common complaint that I hear is that the pregnant mom will say to me, I can't raise my leg. When I go to put my pants on, or when I go to try to go upstairs, raising my leg, I can't do it. Usually that's because of a pubic bone subluxation, and it's something that is corrected really easily with an activator. And right there, I've done that on you. Sometimes it feels a little bit stingy, like a bee sting, but it's quick and it's a really easy adjustment, and most women respond really well. I mean, 2 or 3 adjustments and the subluxation is gone. So I want to tell you a little bit about the 2 techniques that I practice. There are 2 chiropractic techniques that are specializing in prenatal, and they're called Bagenel and Webster. And at one point, the Webster technique was actually called the Webster bridge turning technique, because Dr. Webster actually figured out a way to help babies who were breech to turn. And it was literally by realigning the pelvis in the mom, because if the pelvis is really torqued, it's going to be really hard for the baby to make its way out of this through the birth canal. So the main concept of both of these techniques is that if there is any kind of imbalance, muscular, ligamentous, or bony imbalance in the pelvis and in the lower back area, things are going to be so torqued that it's going to make very hard for the baby to turn into the right position when it's time. Normally about 32, 33 weeks is when the baby should be head down and facing backwards. But when it doesn't happen, that's when it's called a breech position. So before 32 or 33 weeks, babies are in all kinds of positions and it doesn't matter. But by that time, they should be getting into this position. So what we do is to look at the pelvis and see how the position of the bones and ligaments and muscles is affecting the problem. So I want to show you what I did here. I took a pelvis and I actually wrenched this left hip. I just opened it up like that. So you can see how this hip is nice and tight against this bone, whereas this one is really separated. Then I took that pelvis and I flipped it down as if this person was lying on their stomach, and then I took a picture of it looking at it this way. Now look at this. The sacrum and the coccyx are blocking this side. This is really, really big. This is really, really narrow. So the whole thing is really shifted. And for a baby to try to come out through here is really hard. They get stuck right into the sacrum or into the coccyx. They get stuck sometimes into the pubic bone. And so the contractions are forcing the baby through, causing them to do that with their head constantly for however long the period goes. And so this is also causing subluxations in the baby. So for all reasons, maintaining the pelvis in a balanced position is the best thing for the birth and for the baby coming out unsubluxated. As you know, in our office we have special tables that accommodate the belly. You can lie down on your stomach all the way until the last minute. I have adjusted Dr. Johnson during her pregnancies at the last minute. I was adjusted during my pregnancy and all the way to the last minute. So it's a really comfortable position to be on all the way to the end. Here are some interesting things. Chiropractic care can help women become pregnant, maintain pregnancy, control vomiting during pregnancy, deliver full-term infants with ease, and produce infants healthier than the normal population. A lot of this stuff has to do with removing subluxations. Become pregnant is something that happens in a lot of chiropractic offices. Women who haven't been able to conceive, who get pregnant after starting chiropractic care, because subluxations in this region of the spine actually mess up the normal hormonal balance in the body. So once that hormonal balance is reestablished, they start ovulating and they get pregnant. Deliver full-term infants with ease. It's proven that women who are under chiropractic care have 50% shorter labors, less painful, less need for any kind of medication or interventions, and produce infants healthier than the normal population. That has to do with the fact that if the baby can just slide out easily, then they're not going to be subjected to that kind of thing, causing them to be subluxated, or worse yet, forceps, vacuum extractors, hands, tugging and pulling at them, which is how they get their first subluxation. So these babies that are born from women who are under chiropractic care have the best of every world, because they can slide out, they don't have any interferences during the birth process. Now, some of the benefits that the mom and the baby get with chiropractic care after the baby has been born have to do with the ease with which the baby will be able to breastfeed, for example. It's known that as a baby is coming through the birth canal, their little head becomes smaller because the bones actually overlap on one another, the bones of the skull. This is a process that happens so that the baby's head is smaller and it can fit through easier. At the other side, when the baby begins to breathe and to cry, those bones actually slide back into their normal position. When there is any kind of trauma through forceps or vacuums or hands, or just too much pressure on the baby's head from the contractions, there can be swelling that happens in these areas, and that swelling prevents the bones from going back to normal. And this is something that causes the cranial nerves, which normally are traveling through these bones. It can cause a cranial nerve to actually become entrapped right there between the bones. Well, these babies are born, first of all, with their heads asymmetrical. They have a weird shaped head, and sometimes you can actually just measure from here to here and compare the measurement here. Both of those measurements should be exactly the same. When they're not, that usually indicates that there's some overlapping of bones in the smaller side. These babies, it's well known by lactation consultants that babies that have asymmetrical heads are going to be very likely to have trouble breastfeeding. And why is that? Because these cranial nerves that are entrapped are actually responsible for the ability that the baby has to have to coordinate breathe, suck, swallow, breathe, suck, swallow, breathe, suck, swallow. These babies do this 40 to 50 times per minute. The minute they're born, they know how to do this. But really, it's because it's all coordinated through these nerves, all the nervous system, knowing when the tongue needs to come out, when they need to take a breath, when they need to swallow. It's all a perfect dance coordinated by the nervous system. But when there's entrapment of the nerves, either in the cranium or in the cervical spine, one of these functions starts to falter. So either the baby will gag when they put the nipple in their mouth, and this is because there's a hyperactive gagging reflex because of entrapment of a nerve. Or they won't be able to coordinate those three things: breathe, suck, swallow. So really important, if a baby has any type of trouble breastfeeding, right away, the first thing that they need to be checked for is subluxations in the neck or in the head. And I just had today a baby that came in. I've been adjusting him for about a week and a half now, and he was having tremendous amount of problems breastfeeding. His jaw was clamping down on the nipple, and the mom was having to express her milk and give it to him in a bottle because she couldn't breastfeed him. And that's what it was. His head was completely asymmetrical. He had subluxations here. He had been born by C-section, And a lot of moms say, well, you know, if my baby is born by C-section, then he'll be fine. They just come out. Oh no. They pull them by their heads. They have to first fish their head and then tug and pull at them like that. So being born by C-section does not exempt a baby from having subluxations. It's the opposite. They probably will have more. But then for the mom, most new moms have something called the new mom syndrome. And that is that all of the activities that you're doing with your new baby involve your head and your body being in a very slouch position. You're nursing your baby and you're looking at their little face. You're changing them so you're slouching like that. You're bathing them. You're feeding them. Whatever, you know, that first year of life, you're constantly bending in a, you know, in that slouch position. So having chiropractic care during that time is crucial, because otherwise you start developing all the symptoms of this syndrome, which is neck pain, upper back pain, tingling and numbness down in your hands, and on and on. We have another workshop called New Baby, which I invite you to come. It's on the first Monday every other month. So I talk about a lot of that stuff during that workshop. Okay, I think that's it. Any questions?
I had one earlier and I can't think of what it was. I guess I can't think of anything right now off the top of my head.
Okay, well, while you think about it, I'm going to give you a chart. I think you might have that one in your folder. If not, I'll give it to you right again. And also, on this piece of paper, it's called Causes of Subluxation. And it talks about all the things that we should and shouldn't do to not subluxate our children. So take that with you and read through it, and that may even spur some questions that you can ask me.
I don't know if this is something related or not, but what is your take on pacifiers with babies during breastfeeding? Not to do it right.
It's better not to. You know, my answers about certain things are always tempered by other things that, you know, can or cannot be done instead of. Sometimes a pacifier is the only saving grace, so you can have dinner uninterrupted, or, you know. So I would say if you can avoid it, that would be ideal. If you have to do it once in a while, then do it. But don't do it as a habit, and don't just put it in because, oh, let's just give him a pacifier. It's better not to.
What about dairy products in breastfeeding?
Mm-mm.
And should you wean yourself prior to having the baby, getting it out of your system, or?
No, no, because that's only something that happens really quickly. But it would be, especially, like I would say babies should not have any dairy products until they're more than a year old. So if you're going to stop breastfeeding them and switch them to something else.
No, I'm saying for myself breastfeeding.
Right, while you're breastfeeding, for you to not have dairy, yes, but at the same time also the babies should not go to cow's milk. Hopefully never, but but at least after 1 year.
And what's your take on alternatives to dairy? Because I heard soy is good, and then I heard it's not good.
That's also on that workshop,
Okay.
on the New Baby workshop. But just a quick thing, there's rice milk, there's almond milk that give you calcium, vitamin D, you know, a lot of the things that you would get from milk.
So no soy milk either?
I have a lot of the controversial information also, so I don't know what to say about that. I haven't made up my mind.
How about goat's milk?
I think that's better than cow's milk.
Okay.
Yeah.
I think that was it. I don't know if there was anything else. I should have written it down while I...
Well, you'll probably be thinking about this tonight, so just write it down and ask me in your next visit. And I gave you one of these the last time, right? The topics of the lectures that we give outside?
Yes.
Okay, so you know about that. If you belong to any moms groups or anything that would like to have a speaker, we love to bring these topics out to the public.
I try to tell people, but people, I think, they think, well, you're not a doctor, so I don't want to hear anything you have to say. I'm like, you know, it's my third pregnancy, but, you know, I can only give the information to them.
Yeah, exactly.
I'm thinking about a girl that I know.